My parents fought for me.
My mom and dad fought for me.
My parents fought for me. They made sure that I had the right support at home to do well at school and to pursue my dreams.
Meet Minerva. Whether you know it or not, you're fighting for her.
She was like, I think 9 or 10 months when she got the first screening.
Minerva at Play is an example of your generosity at work.
Did you ever see a fish holding a dish?
United Way's DRIVE initiative trains community-based screeners to provide comprehensive early assessments for children like Minerva.
As a mom, you are always like kind of worried if you're doing okay or if the baby is doing okay. It's free, it's done by experts on this area, and it also helps you as a mother to feel more confident about your work, about how you're raising your child. For me, this was the only way to get access to this kind of services, so there was no other way.
Strategic partnerships allow United Way to meet needs where they're needed most, through playgroups, preschool classrooms, or in childcare settings.
We connect with women who are interested in starting up their own family child care program in their home and help them with through the certification process. This DRIVE collaborative is a chance for us to connect to United Way in a really hands-on way, to receive training that we can then pass on to our providers.
And I think our providers play a huge part in the screening process and actually see the children in action and can see the differences between one child versus the other child.
It's not that rare, unfortunately, to identify or find a red flag on a child. A child that does not get identified and helped when it's the, let's say, best time for the child will suffer the consequences later. Not only the child, but the whole family.
We're not waiting till they get to Boston Public Schools 5 years old. We're actually catching it ahead of time. And I think that's where United Way really comes into play, helping us find that out.
And by mining the data gathered, United Way is looking to identify trends and implement solutions, crunching numbers to ensure that kids like Minerva learn to count.
It's better to know if something is going on. All of us are doing our best, but if you have the guidance of this kind of tools, I think it's even better.
There are thousands of kids in the greater Boston area that need screening.
40,000 kids. 40,000 kids.
40,000 kids.
Who are you going to fight for?
Who are you going to fight for?
Who are you going to fight for?